Hello, I'm Janice Karen, Director of Policy, Technology, and Innovation at the Massachusetts Health Data Consortium, or MHDC. I run our Data Governance Collaborative, also known as the DGC. We start each of our weekly meetings with a series of industry quick updates to learn about new and proposed regulations, laws, standards, industry initiatives, and other activity. Join us for this week's updates. And if you'll go to the first update. So NCQA is asking for comment on two new related programs, a virtual primary care program and a virtual urgent care program. And they can be pursued separately or together for organizations that are providing virtual primary care and or virtual urgent care. Comments on their proposals are due April 5th. There are 46 requirements in total. 29 of them apply to both programs. 14 are specific to virtual primary care, and 3 are specific to virtual urgent care. They fall into the following areas: quality and patient safety, care coordination, equitable access, patient and provider experience, and then there's one item under data sharing and exchange standards. So they've requested general comments, as well as they've provided some specific overarching questions for the entire set of programs. And then they have specific questions about some of the particular requirements. You can find more information at the link there. Does anyone have any comments or thoughts or questions? I don't know if anyone has already looked at either of these programs, but feel free to chime in if you'd wish to. All right, hearing nothing, let's move on to the next update. There are actually two USCDI data sets that are out for public comment right now. This one actually was not widely announced. It's been open for a while, and it got extended to March 29th. So the USCDI for public health data set has a laboratory data exchange use case, and the data that's part of that use case is open for public comment through March 29th. And the starting point for that data set was data that was leveraged by HHS during the pandemic, as well as some adjustments that were trying to get the set in alignment with USCDI and other USCDI plus data sets. They'd like to broaden the laboratory data to capture both electronic test ordering and reporting between providers and public health. So they're looking for feedback on whether additional data elements are needed to meet those goals, and whether any of the existing elements should be dropped. They'll also be open to any other feedback that people have, but those are the specific things that they've asked for. You can find information about what they're looking for at that link, and that USCDI Plus website also includes the links to the data sets. You may have to create an account and to see portions of the site, and you definitely need one to comment. So any questions or thoughts or comments there? All right, well, let's move on to the next one, which is actually the one that I saw advertised. USCDI Plus for behavioral health is also now open for public comment through May 12th. This is the entire draft data set. And they again have some overarching questions like how easy it is to collect this data, how important it is, and the burden of sharing these elements electronically. And then they ask for some specific questions. Again, sort of, do we need all of this? Are there other things that should be there? Are these defined specifically enough for easy and accurate collection? How well do these support integration of physical and behavioral health, etc.? You can read them. I don't need to do that for you. The one that I found particularly interesting was the last one. What type of guidance would help map existing data to these data elements? Because that's not something I've necessarily seen them ask before. And I thought that was interesting. Now, I have not had a chance to look at this data set in detail yet. Those of you who were around and worked on our review of the USCDI Plus for quality data set will know that that data set did not include enough information to really evaluate what the properties were and how they were intended to be used. So hopefully they've done a better job and they've improved that at this point. It's been about 9 months, I think, since maybe 8 or 9 months, something in that vicinity, since we reviewed that data set. So hopefully they've learned from feedback they got there, and this data set's a little bit more comprehensive. And anyone have any questions or thoughts or comments there? All right, moving on. So ONC has put out a new report, which is really interesting because it's basically, I'm sorry, did someone want to say something? Okay. So it's basically a best practices guide for interoperability specific to maternal health. And so what they are doing is they're trying to support increased development of health IT in this area. And so they sort of put information about relevant certification programs and ONC managed data sets like USCDI and USCDI Plus, FHIR implementation guides, and other standards in one place. So they specifically talk about USCDI and USCDI Plus for maternal health. And then they break everything else down into 10 clinical care areas. I'm not going to read all of them. You can see them on the page. And so they basically are in each of these areas are talking about certification options and how the data sets fit in and what FHIR implementation guides are relevant and stuff like that. So it was really interesting. I don't remember them putting out a focused report like this. They do this as part of the ISA every year in general, but I don't remember seeing them do it for a specific area before. So I thought it was really interesting, and we'll see if they expand this to other areas that are of particular interest at the moment, or where people are really trying to improve their practices right now. So any questions or comments or thoughts there? All right, let's go ahead and move on then. So CHIA has put out their 2024 annual report. It includes data through 2022, although there are places where it's 2020 or 2021 data. And in some of those cases, we called that out when we were able to do that. So, excuse me, this is a pretty wide-reaching report that covers a lot of different areas. They have a fairly large and comprehensive section on healthcare expenditures, and that I called out a few of the specific items. There's about 20 different things that they talk about, but 3 of them, they had a bunch of trends related stuff, which I thought was interesting. So they looked at the trend from 2013 to 2022 overall, and then they looked at a variety of different categories, different types of payers, etc., for 2021 and 2022. And they looked at enrollment trends, and they basically broke the Massachusetts landscape down into different categories and looked at different components of expenditures to try to sort of tease out a bigger picture of what's going on. They also talked specifically about COVID-19 spending. Again, this is through 2022, so a bulk of the expenditures would have been related to the pandemic. And they also had a special section on telehealth. And then after that, these were more things that they talk about regularly. So they have a new affordability section, which is going to be a regular part of this report moving forward. They also have a discussion about the use of alternative payment methods, and I'm not sure. I did not have a chance to look at that in excruciating detail, so I'm not sure exactly if that covers all different types of value-based care models or literally or just certain things, but they do look at that to some extent. And then another area that I thought was really interesting was they tried to correlate spending across communities with different traits. So they talk about correlation of healthcare spending versus the median family income in different areas. And then they look at race and ethnicity, and they also look at citizenship and where individuals were born. So I thought those were interesting choices of what to look at. I'm gonna feel free to interrupt if you'd like, but I'm gonna just keep going with this. So let's go to the next slide. So again, I'm not going to read every single one of these, but they did do a bit of a deeper dive into they had provider and health system trends, and they did a fairly deep dive into behavioral health spending, and they looked at it by age group and diagnosis prevalence, and also looked at member cost sharing by type of insurance for behavioral health. And then they did look at a variety of quality of care issues, including some quality measures across the state. And here again, they looked at 2020 and 2022. So not necessarily the standard default data timeframe. And they looked at different types of patient experience reporting and maternity related performance and other things that you see there. Again, there were probably about, I want to say, at least a dozen specific items that fell in that category. But they kind of fell into these different areas. And there's one more slide on this if you'll go ahead and go to that. So just at the top level, I just wanted to pull out some of those sort of really high level data. So Massachusetts spent 71.7 billion in healthcare in 2022, and that was almost a 6% increase. And that's almost twice the healthcare cost growth benchmark that we're shooting for. So I don't remember. I know the Health Policy Commission keeps a tight eye on that, and I don't remember what type of actions they typically take when we exceed that. I know that they do sometimes take actions when that is too high, so there may be something forthcoming there. They also thought it was interesting that on the commercial side that more than 40% of members are now in high deductible health plans. That's definitely continuing to grow. And then again, 41% of Massachusetts residents, and this again is 2021 data, reported having affordability issues. And that's more than half if you look at Hispanic or Black residents. And then the last thing that I thought was interesting was the behavioral health spending breakdown, because it's double in Mass Health than for private commercial, and double private commercial than it is for Medicare Advantage. And I'm not sure that I can necessarily, I understand why Mass Health is a bit higher, but it seems interesting to me. I don't know if there's, I know that there can sometimes be a little bit of a bias against getting mental health help in certain age groups, and maybe that is part of what's driving the Medicare Advantage being lower. But I'd be interested in any thoughts people have on that. Anyone want to comment on that, or anything else that we've talked about in these 3 slides?
It could very well be, Janice, that the utilization by Medicare Advantage members has historically been lower because they have not had access to the same number of licensed professionals as people who don't have Medicare. So Medicare just recently started allowing licensed mental health counselors and licensed marriage and family therapists to bill for Medicare. So they were completely cut off from accessing those 2 different types of providers. So that may account for some of the numbers.
Interesting. Yeah, I do. And that's also a good point, because I know a lot of folks are, even when they have insurance, still end up paying out of pocket for their mental health care for various reasons. And so there could definitely be a component of that. I just wasn't, to me, that's something that I've seen be somewhat universal when it happens. So, but that's a good point. Anyone else have any comments on that or anything else that we looked at here? You can find the full report at that link. It's fairly lengthy, but as you can see, it covers a lot. So I think as folks who work in Massachusetts healthcare, it's kind of interesting to take a look at this data and get a sense of the industry as it was 2 years ago, at least. All right, well, let's go ahead and move on. So HHS has put out what they're calling the healthcare sector cybersecurity performance goals. And they've split them into essential and enhanced goals. And they're basically calling out things that everyone should do. And they go in, so each of these areas that I have listed on the screen that I'm not gonna go in, I'm not gonna mention all of them, are on this screen, it's the stuff that they consider essential that everyone should be doing. And things like multi-factor authentication and having some cybersecurity training and using strong encryption. None of this should be surprising stuff. Making sure that cybersecurity is written into your vendor and supplier contracts, and every user has their own account. Again, I just said I was going to read all of them, and I read most of them anyway. But these are all basic things. If you go on to the next slide, where they have the enhanced goals, I would also say that most of these are pretty basic things. So I found it kind of interesting where they made that distinction. But this is where they put things like asset inventory or test cybersecurity testing. And that one thing that I would say here that maybe isn't called out a lot is the third-party disclosures and the third-party incident reporting. I would say that that's the stuff in this list that's really not a standard or basic thing. So it's I haven't had a chance to, they didn't really have a lot of explanation as to what they put into each category, and I haven't had a chance to dig into exactly what they cover for each of these items. So it may very well be that they just go into more advanced specific items in these enhanced goal categories, because there is some, like there is some stuff that could overlap a bit, but I still thought it was interesting how they made that distinction. So you can find information at that link that's on the slide. And what they basically have is they have a list, they have two columns, and the left is the essential, and the right is the enhanced. And you click on each of these categories is a box, and if you click on that box, you go to more details under that category. So any comments or thoughts or questions here? All right, then let's go ahead and go to the next slide. And if you'll pause there. I hope you learned a lot from our quick updates. If you're interested in finding out more about the DGC and its other activities, email me at dgc@myhealthdata.org. That email address is also on your screen.